Dr. Abbyisms and collaboration happens at the top is one of them. It's in this little PowerPoint that I put together, but I really wanted to start with like our intention for today. So just kind of like everyone setting an intention, coming together. Once you kind of know, once you expand, once you grow, once you like feel and see what's possible, you can't go back from it. Like I came back to Michigan, I'm like, no, we're like all supposed to know what each other does. We're all supposed to come together. We're all supposed to have an understanding, because the coolest thing is that there's no one thing that's like healing a person. There's all these different pieces of the puzzle. And it's also super lonely to think that it would only take one. And you guys know that here. Like, how many times is it like, dude, I have no idea. You like, hey, May, so let me tell you, can I pick your brain on this? And then you start to get like other aspects and you start to implement those, and boom, that kiddo gets better faster. So that's what we're after as well. And to not only understand what you guys do, but have, hopefully you guys, when we leave today, have a better understanding of chiropractic. So I think that's my intentionality today, is to say like, be of service to you guys. The other thing is, if you have a child going through something, you have a whole family that's stressed out or going through something. There's no difference, like physical, emotional, spiritual stress, like they're intertwined. I don't care what people say, like there is as much that goes on from the emotional standpoint as the physical things in the body too. So being able to like know that they're in, when it starts, that healing starts at hello is what we say too, that they're in good hands through that process. So cool. Battle Creek, that's kind of like, we call that like our mother location. That's what we started 7 years ago. We have 4 doctors that are all pediatrics, pregnancy, family. We do all cash, so we don't take any insurance. When I was out in California, I was an insurance-based office, and what I found was like, I'm like taking care of the kid that it was covered for, but I was understanding that like the whole family needed support and help and health and wellness. And chiropractic is very, when I was growing up, chiropractic to me was like, oh, you just go get adjusted when something's physically wrong. It's like musculoskeletal, the end. And I was like, oh, okay, because I had a scoliosis. And I'm like, okay, well, it feels good. I don't really understand. Like, it feels like it just goes back, and I don't have any understanding of this. Then, as I got older and older, I started to basically delve into like health and healing from an approach of like the body was made to heal, and we as humans pretty much add a bunch of toxicity or stress or things to it that cause it from dysfunction, essentially. And instead of, it always resonated with me, instead of like waiting to get sick and then trying to cover up symptoms or fix it after it's to that point. Hi.
So sorry.
Do not apologize. Oh my goodness.
Hello.
Nice to meet you. Hello.
I'm Sarah. I'm one of the
Sarah.
VPs.
Very nice to meet you. But basically that, as instead of like waiting to get sick, that there's so much we can do in our life to keep ourselves as healthy as possible. And just the same way as like we eat nutritious food, or we move our bodies daily, or we sauna, or we pray, or we have like all of these aspects of health, chiropractic is another toolkit for us to allow for our body to better adapt to stress or the environment. So it's more about, as you guys know, like the brain and the spinal cord, the nervous system controls everything. Like physiologically, that goes back, why do we check primitive reflexes? Why do we look to development? Why do we look to milestones? Why do we look to like what the body's an adaptation or an extension of the brain, right? And a lot of the things that we see are adaptation patterns to a core problem that's actually a root problem. So I'm like, can we focus on the root problem? Can we try to get to that? Because if we unwind or take care of that, the secondary or tertiary things are going to get better too. So chiropractic just clicked to me in that way. And then when I was in chiropractic school, I got pregnant with my first baby, and I'm like, sorry, I love you guys, but I'm not getting adjusted in student clinic anymore. And I went off site to go get adjusted by one of my mentors, and she was Webster certified. And I'm like, well, if that's the gold standard that I'm going to hold myself to during pregnancy, you better bet that's what I'm going to do for myself to serve other people, right? And I think I was like, people probably thought I was crazy, because I'm like, you guys, this is amazing. Like, women need to know about this. They're like, you are a chiropractor. I'm like, I had no idea. Like, this is so amazing. So going through a pregnancy, a birth, and having that be this story of like such a positive experience in a world where that can be a super traumatic thing. I'm like, like I knew that was one of the reasons God called me to be a chiropractor. Circa after that it's all connected. And I even think it's as connected to preconception as it is to that kiddo we're seeing at year 5. Like a lot of this stuff starts before. And that is part of what we do in the office or try to do is like be a testament to so much creating healthy lifestyles so that we can create healthy births and babies and first years and then humans and hopefully start to get cycles of more well-balanced, healthy people. We do see kiddos for specific reasons, right? And a lot of times that is what they come to us for. But we also see people throughout, like we'll see them throughout a pregnancy, at birth, throughout their pediatrics. So just for you guys to kind of understand, like we see them more of a part of their healthy lifestyle as well, or continuation of care. You never have to, right? Like, it's like the same thing if you worked with a functional nutritionist or you worked with a trainer or something like that. Like, yes, you can learn a lot and you can get results, and you can use that for a temporary time, or you can adapt that as part of your lifestyle and work out for the rest of your life. Like, we're always like, we'll love you no matter what type of a thing. And when they come in, that's very specific to what is going on with them. So if they are coming in for like a torticollis or something, we're gonna be seeing that baby more frequently through that acute type phase versus like a wellness, like a baby wellness adjustment. I used to check my kiddos like maybe once a week, maybe twice a month. But it really depends on stresses that are going on in their life. And you're like, what are stresses for a baby? Well, things that we didn't normally usually have, sitting in car seats for a long time, a history of any like vacuum or any birth trauma. Maybe there's some other like more chemical stressors. Like you do know the kids that have a little bit more like chemical or emotional stressors. So their nervous systems or their bodies just need a little bit more support in helping regulate. And you can do that many ways. Adjustment is one of those things in the toolkit, but also like we talked about, like, of course for kids, movement. Of course, if we could have changed diet, that's gonna be super helpful. Of course, taking them through like meditation or kids meditation, prayer, breathing, all of those can be tools or things that self-regulate the nervous system. The other thing is like, you guys can kind of see the kiddos getting adjusted. I think people watch TikTok and they're like, we did a funny video one time, like I've got a baby doll and I'm like, wah, and just like flew the baby. It's like, it's not like that at all. So when we adjust a baby, I know, right? What we're gonna do is if you guys were to close your eye and push on your eyeball, that's about the amount of pressure that we're utilizing. So they're very soft and you guys can know, like you can call mom and dad isn't that so funny? Dad's the one, mom's like, let's do this thing. Dad's like, I don't know about this, you know? Yeah. They're always, I'm like, okay, dad, like just bring him in, like bring him with you. But essentially like so much more of a tonal adjustment than it is like an osseous adjustment. As you guys know, a lot of that isn't developed and you're releasing things on more of like a tonal versus like a manipulation or an adjustment for an adult that has fully developed joints and things like that. So twofold on that, I'm always like, birth is not a pass-fail experience, and that's one of the most vulnerable times, and we say this a lot, and I love you guys because you love what I love. We also have an understanding that a lot of providers don't. We work with demographics that are the highest of highs and the lowest of lows. We're like with pregnancy, pediatrics, all of that stuff, right? So very vulnerable demographic as well. So starting to help, so for providers, when mom isn't moving, if her pelvis is stuck, I like to explain that. And here's some like preliminary, I don't know how much pregnant moms you guys get exposed to, but like tell who does or like have this under your belt because it's so cool. So essentially like we like to explain to our moms, the pelvis is like this bony basin, right? Like, and the uterus is sitting in that. And we like to think about the uterus like a hot air balloon, and it's tethered or tied down by round ligaments and all of these things that baby's sitting inside. So if the pelvis is subluxated or not moving correctly, you can see a mom with like a locked up side of her pelvis and things like that. Then what do you think is happening to that uterus? And a lot of times you'll hear mom like, oh, my right side of my hip. Oh, it's going down my right leg. Oh, I always have this on this. And I'm like, I'm the worst. I'll walk through an airport and I'm like, That lady's probably 5 months pregnant. Oh, right, locked up. She'll turn around. Odell's like, you're freaking weird. I'm like, I know, but did I nail it? Like, maybe she's 6 months pregnant. Like, but the more that pelvis is able to be in a position that's healthy and movable, the better that the uterus is able to also be in a position that isn't torsion or tight or misaligned, right? So if that isn't, then baby's able to get into a better position as well. And I always, like, we take the camp of your body's intelligently and innately made. So our job is to just help or support your body. Like, we don't do anything. That's why I love chiropractic. It's like, I'm not claiming to do anything. Like, we're here to support your body because it knows what to do, given the chance to do it. So the better that we're able to get mom's body into position, the better outcomes we have with stuff like that. Fast forward, do the best you can until you know better. Like, zero judgment space. My daughter went in a walker down the stairs. I was a chiropractor. I was like, oh, I'm gonna run out to the car. Stuff happens. You know what I mean? Like, we're human. And like, you're here with the best people that like will never judge you, right? Like, do the best you can until you know better, and then you do better. So if we have a situation where mom was sitting a ton during a pregnancy, what's she gonna do? She's driving a ton. She's in her pelvis. She did everything she can. We have a baby with torticollis or birth trauma, right? And I like to say to people, like, you are a beast, and we minimize ourselves so much, and that's okay. But I'm here to tell you that, like, that birth is like running a marathon, 2 marathons. And all the work that you put in, guess what? Your sidekick, your person, you guys work together for that. And as much work that was for you, it was for them too. So that although it might feel like everything was fine, it's fine. And it's not one of these stories, and we do have those stories too, where there was a vacuum used, there were forceps used, there was an external cephalic version, there was an emergency cesarean section, there was whatever. You do have to think about all the hours that you birth on the receiving end of like the strongest muscle ever, your uterus contracting, is that baby too, working, pushing. Like, they have reflexes. Like, it's the coolest thing, right? They're like pushing, working to get out as well. The other thing that happens is that when the baby comes through the birthing canal, if they are a belly baby or a cesarean, I like to call them like a belly birth, because I think that there's so many things that come with like negative connotation that make us feel as women like it wasn't right, or like there was something wrong about that. And I'm like, no, it's a belly birth. However, when the baby goes through the birthing canal, there are things that happen that were supposed to happen. So it didn't. So let's talk about what we can do now, right? Like, we can do seating. There's a lot of vaginal canal stuff. The other thing is it's like a boot for their little brain or their skull as well. So think about our babies that were belly birth and have a torticollis after. Guess what they didn't get? That cranium overlapping and then doing that initial boop, right? But even though it didn't, we can do cranial work. We can do work post to ignite some of that stuff and help with it. And then the other thing is everything's connected. So the more we can explain that to mom, she's like, oh yeah, you're right. Oh, that was a lot. Oh, I can understand how that would be a lot for them too. And trauma looks different. Trauma is this word that can feel so extreme, but really, like, think about trauma as any stress or strain. The car seat can be air quotes and that verbiage, because they're sitting in this position. We can tell you it's like an L4, L5 every single time. I call it like a car seat subluxation. It's like they're sitting. Same thing with our moms that are sitting all day like this. We tell them, like, get up, roll that pelvis forward, get in a seated position, get on your ball, do some figure eights. Like, movement is life. And in a modern world where we're losing so much of that, we get to help them reinstate some of that for function. So we also check tongue ties, lip ties, and really helping or having them know that everything's connected. So when we're checking for like a torticollis, we're checking head to toe. So I know that Hannah wouldn't mind us sharing this, but one of our team members, her little one had torticollis and we walked into a team meeting yesterday, and I'm like assessing her head to toe, already looking at her. So the baby's like obviously head rotation. Instead of just lateral rotation, there's some extension with it too. So I already know there's probably an occiput involved in it. The whole body's off to the right side. So I'm gonna check head to toe, everything's connected. So even if we're just clearing out this, we're doing a disservice to not also make sure that the pelvis is getting cleared out or released, because they're going hand in hand. everything's connected, right? That dura, or all of that soft tissue tonal, connects all the way from up here, all the way down to the into the spinal cord. And then the other big thing too, and I'm excited to hear yours too, but like even in birth, what do we tell moms to do? Relax your jaw, open your mouth. Why does the mouth do so much for relaxing the pelvic floor? Right? Like those two are connected. Isn't that so cool? So think about a baby too. We're trying to work and relax up here. Guess what's connected? Down here too. For example, I'll just walk you guys through that adjustment, torticollis yesterday. So I'm like looking at her, I'm like, man, there's way more occiput in this. Taking them, I'm going through and motioning and checking. And again, just think about that. It's like an art. You guys know, you work with kids, like you're not gonna have them perfectly do the exercise, but you're gonna like figure out that art of getting them to do that motion or movement, because we know that if it fires together, it wires together. And why do babies fling this around? So I tell mom too, every single time, zoom, 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 their brain's developing. Why is it so important for cross crawl patterns? Their brain's developing. So checking her motion, all locked up through that lower right hip's all locked up, but I'm like, primary is definitely this skull and this torticollis. Go up, checking in that, and just doing like little extension and starting to bring her to the other side, little extension. Her occiput and C1 are all locked up, like nothing is moving in there. So I released those two things. Occiput was way harder to release. I'm like getting underneath and just kind of like doing an extension release on that and checking, and she's like crying. It gets released and she's like, and just looks at me, and I'm like, and I was like, I knew, like when I walked in there, like I knew she wanted me to adjust her too. Like, you know when you see a little kid and you're like, they want to move like that. They want like help. Like you can, even like our spectrum kids, like you can, like you see them, like you can see that there's like a disconnect going on, and you're like, oh, let's get your body to reconnect to that. So we get that released, and then I went back through, released like her right side of her pelvis, and then you could see this almost like C-shaped, or like this kind of go completely flat. And that's one of the things post-checking that we're checking is like when I lay them down, are they turning to one side? Are they tension? Are they doing like normal, like what are they doing? And then post-adjustment, what will happen is they're just like relaxed and just straight. And she's still, I mean, it's gonna take a little bit. Like there's no magical, this is gonna take time. And she's also working with a PT, of course too, you know? And then the other thing is that we're looking at is, again, this is just as connected to the lower. So her feeding, her jaw, her mouth, her palate. And Dr. Kylie has more education in lactation. And then our other docs, we have one that's like a doula. She has a master's in women's like endocrine, reproductive. Myself, Dr. Maddie, everyone's Webster certified, but it's like her tongue's almost like bowling up a little bit. We always say that in our office, like we never ever feel bad to be like, I have no idea. And I had no idea what that, you know, what you guys did or how that helps, or even with each other. Like I've been in practice for 10, 12 years now. I'll be like, what was that? Teach me that, you know? Yeah, so we work with some really great lactation consultants. We also have a few different pediatric dentists that we refer to and trust. And I'll show you, we got the who's who. We got to get you guys on there. But our referrals out, and we're explaining to them that like feeding is a secondary thing to, like it goes hand in hand to them having proper TMJ, proper mouth, proper oscillation of that tongue, all of that, right? And I know you guys know, when you hear that, you also are going to hear that mom doesn't feed as well on one side, is having all these other issues, all the things, stress and strain. And this is where we're like, we need to get mom adjusted. Like we need to get the overall health of the whole family better. So yeah, we're referring out to those things too. But it depends. Like we're a huge like functional. I think we swung where they were getting so missed that like now we've kind of swung back, and that's that whole like writing reflex too of it's going to kind of like balance in the middle. It's like, oh my goodness, we were missing these so much. And then I think we kind of went a little bit like laser snip crazy with it. And now I'm kind of back to this midline of like functional ties. Like if we can have the outcomes that we need to reach, if we can have the people that we're referring to, we're way more of a, if you can make it work with the body. We don't want to intervene. Sure. If we have to, limitations matter, let's go. So yeah, but also like that whole, I'm always like, I don't know, I'm not a pediatric dentist. That's not what I do all day long. Let's ask them. Can you imagine if like they're able to come in and get adjusted and chiro OT, like all of this stuff first, and then we're all like 4 to 6 weeks in, we're like, okay, mom's still frustrated, baby's still frustrated, this is still happening. Let's go ahead and like we've done a lot. Or not. I think what we're gonna find is the same thing with like a lot of like shoulder stuff and all this other stuff. We're like, oh, like 90% of the time it's actually getting better. One of the coolest things about OT, speech, PT, chiropractic is that it's really trying to restore function to the body and help your kiddo adapt. If there is underlying like structural constraints to this, it won't matter how many times we stretch this. Their occiput, or don't use occiput, Abby. They're like, my what foot, what, you know? But the base of their head, like these actual bones, like it's gonna just keep going back, or your kid's gonna adapt to it. And that's where like a lot of the research out of Europe and stuff is that even scoliosis, things like that actually start with a subluxation pattern or a shifting or a neurological pattern up here that never got corrected. That's fine. Your body's gonna adapt to it. Is it optimal or not? You know what I mean? It's like even these third world countries, like you break a bone, if you don't reset it, like that's fine. It's gonna heal, you know? And that's our kiddos that we start to get either scoliosis or the brain is gonna develop an adaptation to it. So the way I like to think about that is like a writing reflex. Like you always, your body, your kiddo is gonna get their eyes, ears, survival up and in that position, right? So if it's like this and we don't correct it, what are they gonna do? Adapt their body to it. The end. So I would say to them, like, this is going to, you have to get that underlying structure. You're gonna be in really, really great hands. It's super light, gentle, and these are gonna go hand in hand to get the best results possible for your kiddo.
I always try to explain there's no cracking or popping, the whole technique and how it's very light. It's more like a massage.
Yeah.
And then I try to explain that they're all connected, the torticollis and the tongue tie, and that it's more than just cutting it.
Yes.
And having it, the child be fine.
Yeah, absolutely.
You have to get that structure fixed.
And it's almost like, I like to think of it like a bridge or something, like a complete like tonal system. If you were to just cut one of those and it just like falls on the other side, like there's so much more to it than just what meets the eye on it too. I mean, we've felt that change happening, you know? And again, like I'm super grateful for this because it just is a God wink that we're on the right path of like coming together, because and a lot of times it is that moment of like being a mom when you're just like, I just need help. Or you're in practice and you're like, I don't really know and I need help. Or you're like me, even in this past year, we've come to the point where like, I mean, honestly, working with our NFL athletes, we've been able to do that simultaneously. And I'm like experiencing, whoa, this is so cool to have both of these together. So I'm even curious, like that'd be so cool to take care of a baby like really simultaneously. But I think that that's like one of the biggest things that we can do is be able to just us coming together today, your energy talking to people about chiropractic and getting adjusted will be night and day different.
Yeah, we're more confident.
100%.
What the child really needs.
Exactly. And just like us being able to connect with you guys, we're going to be it's just like going to be like that to be able to speak to what you guys do as well. And the best part about it is that like what we always say, like Odell and I were like, yeah, that's for them to tell you what's needed in that realm. You know what I mean? Like we're like this, they're going to let you know, and we trust them to let you know what like you need over there and over here. And we'll talk. Like that's the best part is like we'll talk to them and we can kind of brainstorm together the best way to have that collaborative communication too on patients too, because that's going to be super helpful. And even kiddos that have any amount of like neurological going on, it's like chiropractic supports the brain and the nervous system. So getting adjusted supports that, or bringing down the sympathetic nervous system and putting them from fight or flight into rest and digest, for them to be able to integrate or utilize or leverage all the other stuff that you're doing to help support their bodies. Does that make sense?
It does. Quick question.
Yeah.
Constipation.
Oh, all day
Are you
long.
gonna talk about that?
Yeah, absolutely.
Nothing you have
So,
to right now. I just
no.
because it will answer some questions. I think.
Yeah, I feel like, okay, so we hit that and that, which is awesome. Feeding, latching. We also have a lactation consultant that comes in and rents space from us, or that we'll refer out to. That's awesome. We are never, ever, ever, we're never, of course, we're always like referring and co-caring. So constipation, and this is awesome because we can go constipation, reflux. So we, even with like reflux, we say to moms too, we're like, one of two things, well, lots of things, but a lot of times if there is a latch issue or these things going on, like babies getting air when they're feeding or different things like that are happening, and we're having reflux. The other, Kylie, and feel free to like add into anything that you're
Going on the same like train that
I
I
know.
was go on to.
Yeah, so we'll go through all of that with reflux as well with them, and how that coincides with feeding, honestly, and what they're happening. And then of course like lifestyle and stuff too. At times that there might be a dietary or another stressor or strain with that. We actually do like diaphragm releases as well. And there's a reflux release. But a lot of times, like even with reflux, like those will go hand in hand too, of almost like, I think about it as like releasing or pulling down a little bit with it too. And the digestive, I'm sure you guys have things in here that you're like, become like taglines. We call it the poop button, because there is an adjustment to the low back that is all the neurology going to digestive system, that it's like literally like, it's the poop button. The other thing is, and they'll like poop on your hand. Like you're like, and there it was. Like it can be that immediate, or it's within like an hour or two afterwards. And again, like you guys, we're always thinking function. So if we're constantly adjusting and they're only pooping after adjustments, there's still an issue. You know what I mean? Like what's the underlying reason that they're still not, like that subluxation or that dysfunction's happening in the first place? But sometimes it really is just as simple of like, that needs to be reset, or that needs to be cleared out, or that's a subluxation that's blocking that. And once it is, it's not really an issue anymore. And the other thing is that these things go hand in hand together too. Like if their latch, if they're taking in air with their feeding, if they're having digested, if they have like a torticollis, they're like this, what's happening with their hip? Do you think it's affecting digestion? Absolutely. We'll also, of course, as we like release diaphragm or the pyloric sphincter, we'll also go through and do like an I love you massage. We'll give that tool to mom as well. Sometimes we're giving them, if they're an older child, we're giving them some like nutritional or supportive things in that. But we really delve on the simple thing that, and this goes for adults. Like I think it's so funny because we're pediatric, so we're constantly like, your baby should be able to eat, sleep, and poop. I was like thinking the other day, I'm like, we say this for kids all the time. Like, it's the same as adults. You should be able to eat, sleep, and poop. Like, how many adults don't even do that stuff, right? Like, that's healthy function. You should have, like, you should have periods. They should not be painful. They should be regular. You should be, like, this is healthy, normal function. You know what I mean? Like, and the same goes for a baby. And that's what we can say to mom too, is like, they should be able to eat, sleep, and poop. And if not, there's something that we can help support them with. There's a gap. There's a gap from like, I don't know, 10 to like 55, where they won't tell you. You get over 60, the old people are like, help me poop, you know? Yeah, and they're like, you adjusted me, and man, I poop so good. And I'm like, you know this is happening in the middle, but they're just not telling you. So yeah, same thing, and same all of the things to that too. We also have arthrostems in our office. You probably saw them in that video. We call them tap taps. Like you should see a baby get tap taps. They're like, ah, like, you know what I mean? It's so gentle. So there's lots of different ways. The other thing, when you refer them over to Grassroots, you can know that like we're having those conversations. If there's a person that does not want popping, cracking, or doesn't like it, there's so many other ways to get them adjusted that they're gonna feel really great about. There have been times where like I have had a baby that you're lightly, have you guys ever picked a baby up and they're like, or like things like that too? Like you'll feel popping or cracking or moving. There's times where I'm like lightly adjusting and there will be a release and I'm like, whoa, that was crazy, but nothing to be like scared of or anything. Ehlers-Danlos or connective tissue or hypermobility, we're going back to tonality with that. The other thing is like, so when I was in California, two of my favorite patients, one was an Ehlers-Danlos and the other was a complete Harrington rod, so a fusion from like T2 to L3. When you're young in practice, you're like, dude, I don't know. I have no idea. What am I going to do for you? You're completely fused. I had another guy that was like basically out of 45 and I was like, please don't waste your money. Like, I don't know what I'm going to do for you. And he was like just this rich old man because California, it was all, they're like, oh, I was a famous this or that, or I wrote this book or, you know, and he's just like, can you just try? Like, I don't care. And I'm like, okay. He probably had like a 15-degree improvement. And for him, 15 degrees was life-changing. And after that, I promised myself, I'm like, you are not that important, Abby. You are not God. You do not know what improvement someone's going to have. You're not allowed to tell them anymore because you don't know, right? So the same thing with like this Ehlers-Danlos patient. A lot of times, although they have hypermobility throughout, they'll have places where it takes more stress or strain or it gets locked up. So it's our job to find those specific locations and make sure that there's proper movement in that or do a tonal adjustment. The other thing when you get adjusted, it's going to light up the prefrontal cortex. So again, brain development, it's going to bring down cortisol. So that's putting it into parasympathetics. And it a lot of times is it's nervous system. So you'll have regulation in other systems such as endocrine, inflammatory, stuff like that. So that's where our autoimmune people are like, man, this is making a huge fibro, all the like catch-all things. Again, it's like, I don't know, but it's a bigger than your nervous system controls everything. It's the same way I think about like working out. Like I don't work out to have like look a certain way. I work out because muscle is your immune system. I work out because I sleep better. I work out because it resets your hormones. I work out because it burns cortisol off. I work out because like if I didn't, I would be a crazy person. Like, you know what I mean? The same thing with adjustments. It's affecting the whole system at whole. But we are never gonna take a overly hypermobile person beyond joint capacity or things like that too. But it like changed her world. I would adjust like her elbows and her wrist and all this sorts of things. And it is like, it's just so crazy what people are living in every single day. Also had with that is cramps too. So we do pubic adjustments.
Okay.
So like when our patients, and we do that during pregnancy too. So making sure that the pubic bone is regulated. And that came out of, I was in California getting ready for a talk and I had like the worst cramps and I'm like, do not judge me. I'm going across the street to Walgreens to grab like cramp medication right now. And Dr. Kaiser Pat, she's like, why don't I just adjust your, like do the cramp adjustment? I'm like out of school. I'm like, what's the cramp adjustment? And she like adjusts my pubic bone. Within like 15, 20 minutes, cramp's gone. I was like, what kind of voodoo magic was that? You know, like, but at the same time, you start to understand the physiology of it and you're like, oh, cool. That is amazing. Like we can reset that if anything's tight or tonal or twisted or off in that way too, that it can represent in these symptoms. We do not do full like cranial sacral unwinding. That's an art that's like 45 to 60 minutes. I knew a practitioner in Oakland. It's an art. It's beautiful. But we do cranial sacral work. But a lot of times when you're doing cranial releases or stretching or things like that, like it takes more time to do. But if we are trying to adjust that baby and that sort of stuff isn't done, it's much, much harder. When we're like coinciding doing that together, the results are just like, it's like they're still gonna get there with just one, but it's 10x when it's together. It's not a single multiplier either. And life's like that too. Like it's not a single multiplier. It isn't like you do this one thing and then you get to 2. It's one of those things where you do these 2 things and you get to 10. Like that's the coolest part about co-care and about like habit stacking or multiplying these things in that positive way. This is a bunch of stuff that like no one cares. Like all the credentialing we get is to impress ourselves or other providers. Truly your patients, they don't care how much you like know, they wanna know how much you care and can you get results for them. right? Like, and did they have a good experience? Were you well referred over to? And for them, when you're talking to them, you can be like, you are going to be in good hands. This is the right spot for you to be at, and this is what they do. They take care of pediatrics and pregnancy. And here's a hack with like anything in life, and we were talking this yesterday, because if you have someone that's like is resistant or is feeling this, the biggest thing you can do is like meet and exceed their resistance. So if they're like, they don't take insurance, it's like, isn't that crazy? Insurance will not cover a lot of times the things that are actually like preventative in nature or holistic in nature. Like insurance is really around to take care of when there's an issue and like reactive care. So the craziest thing is that why they don't take insurance is when you are in network, as soon as you sign that dotted line, you're working to their structure, you're working to their rules. I'm in contract with no one, 0%. So like I have patients that they've traded me chickens. Like I literally had this Grand Dam and I was putting like whole frozen chickens, organic chickens in, and I'm like, I'm living my best life. Like I literally spoke this into existence, you know, but I'm trading chiropractic. Like I'm able to set any amount to and do. Also like provider to provider, we don't have to sit there and justify every single little thing we do. Like I try to tell Mark too, like he's like, I know I over record because he still works a little bit at the hospital and had that history of it. I'm like, you're cash based, like you work for them. You literally can truly write down what you did, what you think, and it's good to go. So it's really, really cool because that is how I would frame it to people of like, yeah, I know, isn't that crazy? Like insurance won't pay for the things your kids need a lot of the time, but I promise you they're there to work with you. And honestly, they stopped taking insurance to be able to serve you better in that. Most of the time, like if we're seeing a little kid, it makes it where we don't have to worry about like when I was in California working within insurance, especially my VA, my Medicaid, I'm like, oh, cool. You have never seen this person. You have no idea the stress and strain this kid's been through, and you're giving me 5 visits. There's no way. I'm like, you might as well just like, I'll take care of you pro bono because I need to see you more than that, and we're going to get you well, but it's going to take more than that, you know? So that's how I would approach it. And the other good thing is like the biggest thing is to have them understand that they're in the right place. Once they get in front of us, we'll do the rest in that too. And we're super straightforward with like, hey, we don't take insurance. That's why we do membership. So we have membership options, and they're all unlimited. So like if that baby needed to be seen 5 days a week, we'd see them 5 days a week, and it's still $199 for the month. Yeah, we can share that with you guys for sure. Yep. So we have an individual membership that's for one person. We have a family that's 2 to 3, and then we have a family plus, and that's 4+. And we have some people that take full of their crunchy little bus families of like 7 kids, full advantage of it. But like, that's truly what we wanted. We wanted to be able to, like in my heart and soul, moving back from California, my girls and I was like, what could I realistically do? Like you guys can probably already tell congruency and authenticity are really important to me. So I'm like, what would I actually be able to swing for myself and my 2 little girls to get adjusted the amount that I do that in my own life? Like I get adjusted every single 2 times a week, right? And the best I ever felt when I was consistently getting adjusted 2 to 3 times a week in California, because it was the first time that I was like able to self-care and self-regulate, and I did that for enough time, added in lifting and stuff, I'm like, whoa, my little kyphosis and scoliosis and everything, I'm like, I feel brand new. And then experience, like you could tell me all day long what chiropractic is gonna do for me. Experiencing it, you're sold. You know what I mean? And that's what will happen with your kiddos and your moms and your people is they will experience it, and then they're gonna start to like know it for themselves as well. The other thing that happens is like if you're working out or eating nutritious food is a great comparison or like linear is like one of the other things I really wanted people to get to was a point where they're gonna experience the actual physiologic changes. So much going on, like that little pain, digestion, headache, symptoms, that is a drop in the bucket to what your body is doing on a regular basis. Right now, our bodies are all turning over cells, digesting food, blinking, heart's beating, blood's pumping. 99% of it is subconscious to us. A ton of our nervous system isn't nociceptive. It doesn't have receivers for us to like feel it. A ton of it is like you can't even feel it. It's autonomous. Like you don't even know what's happening with it, right? So the same thing with healing is they might not feel it for like 3 to 4, 6 weeks, but then you turn a tide where you've changed some physiology, you've changed some structure, you've changed some function, and then they start to feel they're sleeping better. They start to feel their hormones. They have the first period they've had in 8 months. They get pregnant, and you're like, oh yeah, like that is a accumulation. It's the mustard seeds from what you did, and it takes time. So we do a full exam when they come in. We are checking primitive reflexes and things like that too. And again, I love how you put that even with the babies. Like if you can't get them into that position to do the exercises that you need to, the same thing if they're structurally subluxated and they're not able, their body isn't able to move that way, we're less likely to be able to have them integrate in that better way. A good comparison to this would be like, if you're all locked up and you're trying to do a squat, can you still get the squat done? Yeah. Is there a bunch of hip shift? Are you using muscles you probably optimally shouldn't be using? Are you getting balanced? Are you getting neural feedback the way that it should? Probably not. Is it still good to squat? Yeah. But can you imagine if we had someone teaching you a really, really foundationally sound squat and you were adjusted and your body's able to move in the way that it's supposed to move? Compile those, like all cylinders are firing at the same time. It's like, again, wonderfully, perfectly made. Like each of these are happening in a sequence for a reason too. And we can disagree with things even within our own teachings too, right? Like just because they want to pull that you don't have to crawl, we're like, what?
I know.
Doesn't mean that that's correct. Or just because like, again, the norm starts to shift, like what becomes norm in our culture or whatever, we veer off of what was actually like healthier and normal. Like we can be truthful with our moms and with our people of saying like, no, crawling's super important. Like, no, they should be hitting these milestones, or this is what should be happening. And it's like, it's all connected, you know? So it's like you're getting an end result thing. Remember what we talked about? It's like trying to unwind it to figure out what the cause or like the original thing that happened was. Same thing, toe walking, chiropractic helps so much. A lot of that's like tonal tension, and we can backtrack it to upper cervical issues. W sitting, thank goodness for you guys, a lot of like weakness abdominally, but a lot of times there's structural stuff too. Any breech babies are frank breeches, any hip dysplasias, stuff like that. Other joints, think about it getting stressed or strained in a way that's not optimal for baby as well, or kiddos. Other like developmental stuff that we see or do, bedwetting. That is a ton, and we'll reintegrate primitive reflexes with that, but that's usually a subluxation in their sacrum as well, or their upper neck as well. And then we're doing like exercises that they can reintegrate. And again, explaining to them that it's like this like beautiful, you have to have the foundation right to build on. Otherwise you get to level 4 and you can't get a door jamb to work properly, and you could try all day long and it's super frustrating. It's like, actually the foundation's off a little bit. So we need to get back to that. Once that's level, you could put the door jamb up all day long. And that makes so much sense to me. Like even like paraplegic, quadriplegic, even like cerebral palsy, it makes so much sense to me to like put them in a position and get their body moving in the way that it should be so that it's firing the brain. Adjustments and doing, like these things go hand in hand together. It's so cool. And you're in the right place because we do a lot of social media as well, because we can have a bigger impact. Like we were on with doctors last night, and once you start to realize how extremely small you are, this is a drop in the bucket of the abundance in the world of like what we can, and the impact we can make. Like we were on last night in our mentorship group, and we have docs out of Germany, out of like South America, out of like all over. And the craziest thing is like they're real people. Like they're just people trying to learn and do, and we're like, oh, I want to learn from you as well. And we're crazy lucky in the United States. We have a physical therapist from Egypt, and the most he can make even owning his own clinic is $200 a month. I'm like, that's insane. Like that's crazy. So our community referral partners, I thought this was kind of cool because who we are. The first one, of course, we have ourselves on there as pediatric chiropractors, but then we also list the other pediatric chiropractor in Battle Creek. Then we list the Antonetti Chiropractic in Kalamazoo, who are amazing pediatric chiropractors over there, and we have an East Lansing one as well. Like, we truly want people to get the care that they need. Like, if you're seeing a chiropractor, go where you, like, get the care you need. Collaboration. Pelvic floor, of course, we have, like, our Oaklawn, we have one at Battle Creek, pediatricians, whole family direct, Andrea Mosier's at Grace Health, we love her. Functional, we've got Functional Vitality, Acupuncture Alternative, we have a list of home birth midwives, birthing centers, birth doulas, lactation consultants, pediatric OT, pediatric physical therapy, behavioral, craniosacral. We'd like to get some mental health providers, myofascial. You guys can see our registered dietitian. Stand by if you find, if you find one that like is, massage, pediatric dentist, and this again is who we're, Mitten Kids is a huge one. I need to get up there and meet him in person. There's also this really cool like airway dental specialist too. So if you guys feel like you just aren't getting anywhere with like airway stuff, mouth breathing, the other thing, like we have a kid going on a CPAP. What is happening? But that sort of stuff too, getting them over, and even just like it's all functional, right? So if we can add all this stuff together and we're starting to open or do those things, orthopedics. So we'll share this with you guys as well. But always open to adding to that as well. So we need your help too. Move fast, embrace change. True support isn't just doing our jobs well, it's going above and beyond for our people. Think big, so see beyond current limitations, envision greater possibilities, challenge the status question it. Like, how can we work together? Why do we have to? Like, I'm the worst person with rules because I'm like, why? If it doesn't make sense to me, I'm gonna push the envelope of it. We have the chance to change the world. Execute excellently, maintain high standards, pay attention to details, deliver consistent results. Your role to match this energy. Remember, you're not just filling a position, you're fulfilling a purpose. You're not just doing a job, you're building a legacy. You're not just supporting a doctor, you're changing healthcare. You're not just working in practice, you're creating a movement. So the community we've dreamed of, the one that we're fully aligned, where we can move without fear, where everyone feels supported and engaged, it's possible. It starts with us making the decision today to lead differently. Know you're worth it, get solid in your vision, share it, and don't settle. Everything had to break down to build something that could actually grow and scale. Here's our socials. We have Grassroots. We have the cafe that we own. I have a personal brand, would love you guys to like stay connected. I also have a podcast, which is the Expansion Podcast. Talk a lot about teams, care, business. We work with a lot of like people that don't want to work within traditional systems too. Like they're building out cash flow and different areas of life too. One of our best friends is like travel PT, that she does like 6 figures a month just teaching travel PTs how to like build out their own online stuff. It's so cool. But yeah, so we're really grateful to be here with you guys. And if you have Instagram, like would love to get connected on there as well.